Dr. Cat, epidemiologist. I'm doing a multi-part series on the techniques that people use to spread misinformation about COVID-19 and the vaccines. If you're interested, follow along. Today we're going to talk about cherry picking. Cherry picking is when people focus on specific data points that support their position, usually a controversial one like the vaccines don't work, while ignoring relevant contradictory evidence or an entire body of evidence. For example, some people say that vaccinated people are super spreaders and that the vaccines don't work. This was cherry-picked from one case series that was published in the MMWR in July. This case series involved a Delta variant outbreak where 74% of the people involved in the outbreak were fully vaccinated, and their cycle threshold values on PCR were equivalent to those people in the outbreak that were not vaccinated. But while this cherry-picked situation is true and documented, it also ignores the entire body of evidence showing that the vaccines are effective. We know based on the entirety of U.S. evidence that unvaccinated people have a 6.1 times greater risk of testing positive for COVID-19. So you can't spread a disease that you don't have. So it doesn't sound to me like the vaccinated people are the super spreaders here. Cherry picking this one study also ignores some of the other studies we have showing actual viral loads being lower in vaccinated people. Cherry picking is done both intentionally and unintentionally. When it's done unintentionally, we call it confirmation bias. Confirmation bias causes us to process information according to our pre-existing beliefs that we already have on file. Intentional uses of cherry picking are used to strengthen an argument, to make it sound more persuasive. To avoid misleading data based on cherry picking when you're making your own health decisions, please make sure to use data from a reputable source like the CDC or the WHO.